This, Tshwane Executive Mayor Cilliers Brink and the MMC for Health Rina Marx, in partnership with the Mpathy Clinics, have launched a healthcare facility. The clinic caters for communities that cannot afford medical aid. Newzroom Afrika Zola Sholwana joins us live for more on that story. Zola, it sounds like great news there.
Well, certainly, Masa, as you would understand that there's a huge pressure on the national healthcare system, especially in public hospitals and clinics, where people have to stand long queues to be attended, mainly because they do not have medical aid or they come from low-income households. Now, Mpathy Clinic, together with the Tshwane municipality, have launched this facility that will be offering a number of services, and of course the organizer will be telling us more about that. This is to ensure that people don't have to go far if they want basic, primary or high quality, high care service. And we are told that Mpathy Clinic launched its first facility in Gugulethu, 2 in the Western Cape, followed by Soweto in Naledi, and this is another one. In the next 5 years they are hoping to at least have about 70 of these facilities. But to tell us more on what led to this project, we have the MMC of Health of the City of Tshwane. Ma'am, thank you very much for your time. If you could just maybe tell us about the build-up to this launch, securing the land, the partnerships or stakeholders that were involved in this.
About a year ago, I've met with Lerato from the Mpathy Clinics, and she asked me about the possibility of putting up some of these clinics. They've got 3 different clinics in the format of a mobile one, these dome ones, and then the building ones that they actually use a current building and upgrade it, or they build a place and they do it as a clinic. So it's very good. I looked at the concept. She gave me a proposal. I looked at the proposal, and then I started having talks with different parts of the city of Tshwane, because you have to go through a process in order to get a ERF to put up these clinics. So I went to one of the owners of the Solomon's groups in Pretoria North, who was so nice to actually offer me this ERF at no cost. So all they will have to do is pay the services like electricity and water supply. So we started the process. Unfortunately, they have to submit plans, building plans. There's a lot of documentation and approvals that they have to go through. So we had quite a few challenges, and I didn't want to make it public before I knew it was actually authorized. And about 2 weeks back, I got the authorization to put up the clinic here, and we started the process. And I'm very happy, because my vision at the beginning of my term 2 years back, I said I want to bring health services closer to the community members. Some of the areas are really far away from current clinics, and they have to travel with public transport, and that's also very expensive. So they travel from places like Winterveld to other areas to go and see the clinics and get their medication from. This clinic is in an area where there's a really also very poor people staying, and I thought let's pilot it here in Pretoria North and see how well it works. I went to Winterveld earlier last week, and we looked at different ERFs there as well, and we've got a perfect site that we're also going to put up one of these clinics. So it brings all the services that one of our public health clinics render to the community members. So it will include even the vaccinations for babies and children. It will look after patients with HIV, AIDS, TB, all those diseases that you get in other clinics. They will also get their medication at a very low cost. So they will do it at a low cost. There's also people involved that might be able to sponsor us, especially when it's patients that don't have the money to pay for the services.
Thank you very much, MMC. I'll have to cut you short there. Let's come to Lerato, who will tell us more, who's part of Mpathy. Lerato, if you could just maybe tell us about the services, that will be rendered here, understanding that this will actually be catering for low-income households. If you could perhaps tell us about the figures, how much can patients expect to pay when they're coming to, see a doctor here?
Patients will be expected to pay an average of 150 and no more than 300 rand. And for children, they are not going to pay more than 100 rand. So that's how much the patients will be paying.
Are we perhaps maybe seeing, these clinics expanding in the city of Tshwane, going to, other parts, especially in townships where we understand there's also a need of, such clinics that are quite affordable, and, you would understand that most people there are unemployed and can't afford to pay for doctor's consultation?
Most definitely. I mean, our partnership with the Department of Health actually is the driving force behind how we select the sites. So we're currently in conversations with the Department of Health in Tshwane, and we've identified Winterveld as the next site in Tshwane.
Thank you very much, Lerato, for your time. Massa will also be speaking to the community, people that will be benefiting from these facilities, and find out how will these clinics be making their lives easier. Back to you in studio.